Good morning and welcome to another edition of Doc Talk. I am coming to you live from GNH hospital today, and I am right now sitting much more comfortable than I was when I was shooting in other hospitals. I have mostly shot in the hospitals where it was supposed to be a mother and child department, but I am actually, to be honest, I'm very happy to see something different coming up in city of Gurgaon. Mostly you see hospital counting number of beds, trying to be more and more revenue-based hospital, but this is a hospital which I have seen looks very aesthetically different from other hospitals. This is a mother-child center, but it's not department of mother-child as you would see in other hospital. It is Kilkari Mother and Child Center. Name suggests it's all so beautiful, calm. Just imagine the Kilkari of a newborn. Just look at my background. That's beautiful. This is something amazingly different from other hospitals. Today I'll be joined by one of the leading gynecologists who is the consultant obs and gynae over here, Dr. Smita Vats. She has an experience of more than 10 years and she is considered as one of the best doctors and gynecologists when it comes to menstrual disorder. Most of the gynecologists would be treating menstrual disorder as a normal problem, but I have interacted with her in the past as well, and she seems to be having an in-depth knowledge about menstrual disorder, whether it's about and how is it going to affect the fertility and what are the lifestyle changes that are going to be playing an important role in this. So we'll be talking to Dr. Smita Vats about all these, and I was just told that she is heading the menstrual clinic. So this hospital is coming with something amazing. You see hospitals, and this is menstrual clinic that Dr. Smita Vats is heading. There are a couple of more clinics, like there's breast clinic. I haven't heard in my career till now breast clinic in a hospital. Then there's a PCOD clinic. That's amazing. So let's talk to Dr. Smita Vats about this. Let's hear her opinion on the menstrual disorders that most of the females would have faced in their lifetime. Let's see what she has to say about Dr. Vats, and welcome to Kilkari Mother and Child Center. And first of all, I should congratulate you for being part of this beautiful center. So, as I was told that you are basically more into menstrual disorder and all those things. So, and we are seeing that the menstrual disorder in females are quite rampant these days. First of all, I would like to understand what exactly is menstrual disorder. It sounds quite big.
Considered as any kind of irregularity or abnormality in either the duration of the flow during the periods, either the amount of the flow during periods, or the frequency of the periods. So sometimes some people may feel increased frequency of the periods. They may feel they may be having periods more frequently, say 15 to 20 days cycle. Normally the interval of period which is considered as a normal interval ranges from 21 to 35 days. So if you are having your periods every 21 days or up to 35 days, that is considered as normal. Any frequency beyond that, either less than 21 or more than 35 is considered as an abnormal period. Similarly, for the duration of the flow, any flow which lasts between 2 to 7 days is considered to be normal, provided the amount of flow is alright, it's not more than 80 entire duration. Any flow which lasts less than 2 days or more than 7 days is considered as normal.
So, that is what are the problems that generally apart from irregular menstrual disorder? So there might be a reason because of which these abnormalities happen. So what are those reasons? Definitely there are a lot of reasons which lead to menstrual abnormalities. We should be discussing them depending on the age of the patient. So they are divided into girls in the adolescent period, the women of the reproductive age group, and the women of the postmenopausal age group. So in the adolescent period, the primary disorders which may be happening are sometimes primary in the period, which means there is absence of the onset of period up to the age of 14 or 16 years of age. And those have endocrinological basis, or sometimes they have malformations in the genital tract which are leading to absence of flow. So those have to be addressed accordingly. Apart from that, there may be coagulation disorders, which is any defect in the clotting ability of the blood of the patient, and there may be hormonal disorders like thyroid disorders.
One reason which is very common in adolescent age group nowadays is polycystic ovarian disease, which is a lifestyle disorder basically, and is related more to obesity, a sedentary lifestyle, and abnormal eating habits also. So that also leads to a lot of irregularity in the periods. It leads to delayed periods, sometimes absence of periods for months together, and variation in the amount of the fluid. When we come to the reproductive age group, in the reproductive age group, women from 20 to 45 years of age. So the primary cause which needs to be ruled out in any woman of reproductive age group who is experiencing abnormal bleeding is pregnancy, first of all. And if at all pregnancy is diagnosed, that needs to be addressed in a very definitive manner and has to be dealt with accordingly. Then the other causes would be sometimes infections, sexually transmitted or otherwise, any infections of the pelvis or the genital tract. So they have to be treated accordingly. Apart from that, there will be hormonal disorders. There is an entity called as dysfunctional uterine bleeding, in which no cause or no pathology as such is found, and a woman is experiencing an abnormal pattern of bleeding without any known disorder. So that would be dysfunctional. Most of the time it is because of an hormonal imbalance or sometimes an abnormality in the lining of the uterus. So, and apart from that, other ways like fibroids, like cysts, like polyps in the uterine tract or in the cervix, or any other abnormality in the genital tract, that also. These are apart from the normal coagulopathies or the bleeding disorders which may be there in any age group. Then irregular hormonal medication intake, or some women may, like cardiac patients or other hypertensive patients, who may be on anticoagulant medications, which are actually blood thinners and may sometimes lead to excessive bleeding within the periods. So those are the primary causes in the women of reproductive age group. In the post-menopausal age group, the women may sometimes feel onset of blood flow or any kind of spotting or bleeding maybe after the cessation of period for about a year or more than that. So in those women, the primary causes will be atrophic endometrium, that is excessive thinning of the lining of the genital tract, which leads to breakthrough bleeding at times, and sometimes there will be overgrowth of the lining of the uterus, which is known as endometrial hyperplasia, and in very rare cases there may be a malignancy, that is a cancerous growth, or sometimes there may be a benign problem. So in the postmenopausal age group, again they have to look for the causes of the abnormal bleeding, and they have to treat the cause.
Will you relate this to lifestyle changes that we are seeing these days in terms of late marriages, early puberty, or the kind of food and the lifestyle that we live? So are these menstrual disorders related to them?
Definitely. The lifestyle changes and the lifestyle diseases all have got a lot to do with the menstrual disorders. So like I discussed in the adolescent age group, the main problem with the adolescent girls nowadays is because all of them are leading a more or less a sedentary lifestyle. They are busy with their studies throughout the day, they go to school, there is absolutely no physical activity. They are focusing more on junk food rather than on nutritious food like fruits and vegetables and the other home cooked foods. And the diet includes more of fattening foods, which leads to obesity, leads to irregular periods, leads to a lot of hormonal imbalance also. So there it is related to that. Apart from that, a lot of excessive stress and anxiety that they might be experiencing related to the studies or to the career or whatever. That also disrupts the hypothalamus-pituitary axis, which is the way that the brain relates to the genital tract in the ovaries and gives a signal to the ovaries to produce an egg regularly, and kind of a hormonal balance is maintained. So in presence of an excessive amount of stress or anxiety or any kind of an eating disorder, maybe excessive eating or too much of dieting, that also is related to these abnormalities in the signaling from the hypothalamus-pituitary axis to the ovarian hormone production. So that again leads to a lot of menstrual disturbances. Similarly, in the reproductive age group also, the stress and the anxiety of the daily routine life that we are experiencing, plus the dietary habits, again lead to hormonal imbalances, again lead to anovulation, that is failure of the ovary to release egg